Hi everyone in YouTube land, it's Melissa, and today I'm going to discuss my very last internship rotation for dietetics! Yay! That rotation that I did was bariatric rotation. It was a 2-week rotation, which was 80 hours, and 4 of those days were spent with the registered dietitian doing clinical work, so the days in between were spent on bariatric surgery. Things I did included counseling patients, taking dietary food recalls, educating patients in a bariatric class. I also got to experience a bariatric surgery, and I got to help create their binder that they have to give the patients when they're on their education route, when they're, about to be given education. We would teach them exercise like resistance stretching if they couldn't stand up or sit down. So we would, use the armbands or use the ball and kind of like toss it to each other so that way they can understand how it works. And when they go home, they can go to like Walmart and buy the bands or the ball or just weights and maybe help or incorporate their family members as well to help them begin this journey. In the class, we would go from the very beginning of nutrition and just, 2 hours straight talk about nutrition and what their pre-op diet is going to be like, what their post-op diet stage or phase 1, 2, 3, 4, 5 is going to be. I got to experience the surgery. What I did was I got to sit in the OR room. You're not allowed to touch anything. You have to put on the scrubs. You can't touch anything that's blue because it's sterile. And the doctor comes in. She gets everything ready. And what they do is they poke holes in, they put the robot hands in, and then they blow your stomach up with oxygen so it gets big and the robot hands can work in there. And so the doctor goes to the side of the room because there's this really cool big huge box with binoculars in it. And she'll sit in, and then she's got it's like almost an 80s virtual game. She's got handles that hold each one of her fingers in, and she directs the robot hands that way, and she's just looking. And then she's also got foot pedals on the floor, so she can kind of direct the robot hands the way she wants. So that was actually really awesome. I'm glad I got to experience that operation. And if you're in the bariatric rotation, I highly recommend that you ask your registered dietitian if you can experience that. Then I got to work on a binder, and this binder is given to the patients during the education portion of the program. And I got to work on supplements. So what I did was I went through their supplement sheet, and my job was to call each and every company to see if they had been certified by a third party. And what that means is that a third party, someone random outside of your own company, test your products to see if they're safe, if they've got the right minerals and vitamins within them. I called each and every company. Most of the companies had not been tested by a third party, and you can use those products, but you don't know if they're safe or not. We also did the bariatric support group, and it's people who have gone through bariatric surgery and have lost so much weight, and they're all together supporting each other, telling each other stories, giving each other advice on what to eat. Okay, well, that's actually it for my series. This series is done. I would like to thank you again for sticking with me and watching all of my videos, and hopefully I've put you at ease for the internship rotation experience. So thank you again. Have a good day. Bye.